one of the questions that got sent to me, it's interesting. Somebody just sent in, well, what KPIs do I start with? And I always find that interesting because, in our business, building software, we were just having a call this morning where, you have 15 things you want to get done. And if you asked everybody individually what to do, you'd come out with five different answers, right? From the five of you or the four of you leading this call, you'd have four very different answers. So I'd love to get some answers from the panelists on, you know, if we look at where do we start, obviously there's a top-down approach, right? Where you have CEOs, you have COs, you have C-suite that you might be able to give some advice on, okay, here's where I would start. And I'd love to then hear the inverse, right? If you're a team member that runs a front desk, or you're a team member that just runs one particular component of the organization, where do they start, or how do you evaluate that process of where to get started with KPIs and then lead that to the top of the organization? So how do you all decide where to start with your KPIs? There's a million of them.
Well, the first place to start for me is our company goals, right? Because every company, we're more medical based, not cosmetic. We have so many locations. There's lots of factors, right? So what are my owners? What are their company goals? And so that's where I always look at and start there first. For us, one of our main, and I'm sure that's majority of everybody, is obviously patient experience is our number one objective at our company. So when we're looking at stuff, we start there. And then we also then look like financially. I think, Noah nailed it. You got to start where he started, looking at your reports and dashboards to see where the biggest hole is, I guess, so to speak, that makes the most sense to begin. And then also, but sometimes it's nice to get low hanging fruit where you can fix something that everybody can get the buy-in and win. For the front desk, vary that patient experience that affects billing, because if they don't get the demographic information right away, if they don't know how to kind of scrub the claim at the beginning, there's that trickle down effect. So for me, whenever I'm looking at something, I always start with what is my owner's goal for the company, and then go from how the patient is, and then obviously money. Sometimes, and most of the time, those two in my mind are almost in sync, because if we bill correctly, if we get that information, the patient's less frustrated. They're not, what's going on with your practice? I got a claim almost 9 months later. I mean, so a lot of it is a trickle down effect, but we start with what is our company's objective, our goals, and then I go from there. A lot of it is built on billing, but a majority of it is on our patient experience. But I think you have to start with where are you and where do you want to go? And then your KPIs kind of define those two things. I have to know where I'm at. If my denial rate's over 10% and I want it at 5%, well, I got to know that it's at 10% or 12%. And I know my KPI is 5%. Well, then I have to start to define that. And I have to look at why am I not meeting that metric? Why am I not meeting that goal? And then you start to do that investigation with your team and so on. But I think for me, it starts with what are my company goals? How does it impact my patient? And then I look at where I am and where I want to go.
Yeah, I love that answer. So align the goals across the organization. Now, each department may have a different KPI, but it's got to have an end result or impact on that goal. For lack of a better words, I'll say pitted the providers against the providers, meaning, here's how many appointments this one sees on average. Here's what this one does, even down to the how many units of Botox was used versus this one, so that they're seeing it on a daily basis. So once you have the data warehousing, you can create and customize, or you should at least be having a partner that can create and customize. Many practices, you may have a team member. If you don't have the budget, which we're talking about today, to be able to just go adopt a new solution out there, if you have somebody that can create these reports, it's very, very important. And a lot of those reports, which we've all talked to a little bit here, it leads towards changing behaviors, right? Once this data becomes available, it sort of takes the cloak off of each team member, and everyone's just living off the data, right? It's what the data says is what we need to drive ourselves towards. And so I think automated delivery of data is great and hugely important. The other thing you mentioned, Noah, um, which we see is important with a lot of individuals, is yes, decision making off this data is important, but a lot of groups it gets to speed to decision making, right? And you need to think of that as well. If you're taking months to create a report or weeks to create a report, and you're making a decision 30, 60 days in arrears, eventually that becomes a bit slow too. So automating that reporting becomes so important to practices, because speed to decision making is critical, right? You can make decisions too slow, too often. If the data is inaccurate, you're making the wrong decisions, right? And so you want to make the right decisions as quickly as you can. Now, one of my takeaways from hearing all of you speak is obviously you all are running or come from organizations that are highly dependent on data, right? You're running your businesses off the data. For our members that joined that aren't in data first organizations, but maybe want to be. And I see this often. I see a team member, maybe it's from the marketing team, trying to get the rest of their leadership to run off of data and to understand data, or the call center to want to understand and run off of data. What kind of advice do you have? I know this can be hard because you all run data first organizations, for individuals in organizations that aren't running off of data, and how to get their leadership teams or other team members to understand the value of the information. Again, I know that can be tough to put yourself in those shoes, but I meet practices all the time. I can speak to the four of you, data oriented people. I can come across one that's like, I don't need the data. I'm doing fine. I'm doing okay. Maybe at the top, but you've got to get somebody to kind of rise up through the ranks to educate on the value of information and data that's available to them. So how would you handle that if you're a member that is trying to expose the value of data in the dermatology business?
I think data is objective. So if I can say to my front desk, I want you to do this, and I don't agree with that. I think this is how it should be. You can kind of get into discussion about what's right or wrong, but the data, it supports where you want to go. So you can't really argue. I mean, math doesn't lie, right? So if I used denial rate before, if our denial rate is at 15% and my builders are like, well, we're fine. Well, the data doesn't lie. So it's not like I don't like you, or I think, you're not a good person, or I'm not making a decision based on, it's objective, not subjective. So I'm making a decision based on what is best for the patient, in the practice, right? So what I found by giving those numbers, and I don't get too caught in the weeds. My managers, I kind of go there with the team. I make it more applicable when I'm talking about like, hey, we're just not capturing this. I don't get too caught into the percentages and numbers and stuff like that. But what I can say to them when I'm trying to change something is like, hey, so we just did this measure, and everybody can understand that. And the measurement shows that we're behind, or we're not meeting this metric. And so here, how can we fix that? So most people will come alongside that versus like, well, Teresa's just making an arbitrary decision, and she's just, because she's upset with the nursing department, or she's upset with the front desk. No, I mean, I have the math, I have the data to support that. And I find that when I'm dealing with team members, whether it's my owners or any managers, or even my team, when you formulate it like that, then they know you're not, they get it, right? So they realize it's not a personal, that I want to change the way the front desk is, or it's not personal, I want to change the, how my MAs are interacting, or seeing how many patients they need to see to meet all these metrics or something like that. They see it that, hey, we're not meeting this. MIPS is a great one. We have to meet MIPS. So my nurses get that. They understand that metrics have to be met. So that's how we approach it. And it's not really like, hey, I don't like the way you're doing nursing. No, this metric's not being met. And here's why it's important. Here's how it affects the patient. Here's how it affects the practice. Here's how it affects your team. So when I'm approaching it, I'm still got the data to support my decision, or how we can go about fixing it, or get them involved in fixing it. But it's a base of starting it, and it's not based on my personality, their personality. It's very objective. That's why I like data as a manager, because I think it gives credibility to things that I want to change or implement, and or get their feedback from, which is what we do here. But it's a baseline for us to start off on, and it's kind of easy to see and not be offended by, if that makes any sense.
There's a couple of takeaways that I had from this just to round it out is obviously I think we're all in agreement that working goals based is really important, right? You've got to set and establish your goals and work backwards from your goals to produce the KPIs. And obviously, when we talk about KPIs, it's very broad. Each individual department is going to have their own set of KPIs. And when it comes to data, when it comes to KPIs, and when it comes to financial literacy across an organization, it can be really, really easy to have a bowl of spaghetti real fast, right? And that can make people's heads spin. And so, from my perspective, we've talked about how each individual department needs to have a few KPIs. I really like the sort of transition for each individual department to have OKRs, which Noah brought up, in aligning goals that help achieve KPIs. And early on, when you start to do that, I think that it really helps team members understand their impact to KPIs. And the impact is way more important than the KPI itself. Teaching someone and educating someone on how to have an actual impact on a metric or on a lever that pushes a business and an organization forward, and teaching them on how that impact or lever impacts their colleagues and the other team members in their organization, really not only helps them achieve the goals that you want as an organization, but it's going to help you learn who you've got on your team, right? And really start to understand, their interest and efforts in building up the entire organization.